So let's get started. Let's jump in. It's a Tuesday afternoon, and welcome everybody. Obviously, so happy that you're here. So proud to be a part of the Next Gen organization and the group. And I think back, so people ask me, why do I do what I do? I fell in love with the respiratory profession, the difference that it can make. Um, my daughter, when she was born 18 years ago, she actually had RDS and she was intubated on a ventilator, got 4 dosages of surfactant. So that's twice the normal amount. And every evening, I was teaching at the time, but every evening that I would lay down, I had a plan. And I would share it with the nursing staff of, hey, if my daughter does this, I want her to go to this special hospital. And if my daughter does this, I want her to go to the other hospital. And the cool thing about it is I had already called my little network of friends and they were on standby. They had all of their therapists alert that my daughter was sick and she was okay. Even though she was on a ventilator, she was okay. But I had a network of people that were there to take care of my daughter. And I realized how important not just my hospital, not just my team, but how important the network and the family of respiratory care really was. So when they asked me to join this opportunity to introduce current students and new grads and early professionals to the network opportunities, I was all on board. So let's jump into it. Uh, Heather's already mentioned it. If at any point in time you have a question, throw it in the chat. She's going to monitor it during the process. And I want to talk about your questions when you have them on your brain. So feel free to throw them in the chat. And then my email is also in the chat. You're more than welcome to email me throughout, not just your next gen career, but anytime you want to reach out. So let's go. What are we going to talk about today? Why are we here? Well, we want to learn about some possible resources of how we can make ourselves a better therapist and how we can improve our profession. So how many of you remember, especially you new grads, how many of you remember your first year, first day, new student orientation, and all you could think about was, wow, this is going to be the longest 5 semesters, 6 semesters of my life. And some of it was. And then our students who are entering their second year, you can actually see the end of the tunnel. There's actually a true light, and it's pretty bright. And then your recent grads. I'm a mountain person, so my tunnel looked like the left. I had people who love the beach, and well, my tunnel looked like the one on the right. Not only can you see the end of the tunnel, but you're there and it's time to launch and let's go. So you ask the questions, well, I'm at the end of the tunnel. I'm in school. What do I do now? Hmm, hmm. Deep thoughts on a Tuesday afternoon. Maybe I'll go get a job. Some of you can actually get jobs in your state as a student. Some of you have to wait till you graduate. But how can we get a job? So I did a very non-scientific poll. I have a really big network of coworkers and friends all across the nation. But I polled 50, actually a little bit more than 50, but I got responses from 50 different department leaders. Some were managers, some were department educators, some were supervisors, but they were all in a leadership position at their facility. And I asked them 3 simple questions. What advice would you give a current student? What do you look for in a new hire? And how can students or new grads improve their chances of being hired? 100%. Every one of them responded individually, and they said clinicals equal a job interview. And I tell my students that all the time, but to actually have a 100% backing from 50 different leaders really hit home. And they weren't just talking about the clinical knowledge that you have, but it was the entire process. Be prompt. If you show up to late to clinicals, they think you're going to show up to late to work and they won't hire you. I also had a couple of directors tell me that they had students who wanted to work at their hospital, and they told the director that they were going to apply. And he said 6 months later, he's actually still waiting on the phone call from HR that says they have applied. Or even worse, I had one director tell me they actually uh, got the application. They themselves called the student to set up an interview, and the student never responded. The student told him, said, "Hey, let me check my calendar. I'll call you back." And he's still waiting on the phone call to schedule an interview. And that was 3 months later. So that application actually went to his do not hire process. So be prompt and tell or make sure you follow up with what you tell the interviewer you're going to do. And then there's a level of professionalism. If you've been at a clinical site for, the last year and a half, and you know everybody's first name, if they tell you to call you by their first name, by all means, that's fine. But if not, when you go into your interview, you respond with, "Hi, Mr. Jones. Hi, Mr. Smith. Hi, Miss Jones." So make sure you call them by their first name, and that's just a level of respect for their position. The directors also said they want their new graduates and students to be prepared to work for the hospital. Now, if you're a student, the directors know your number one priority is graduating and passing your board exams. Because if you don't pass, or if you don't pass your classes, if you don't graduate, then you can't continue to work. But you need to be prepared to be flexible. As a new graduate, as a student, you need to be willing to work night shifts, work weekends, work some holidays. That doesn't mean they can run over you and you have to work every weekend or every holiday. Although when I was in school, they actually set up a weekend package. I worked doubles on Saturday and Sunday, and they actually paid me to go to school. So there are some advantages to working weekends. The hospital directors also want you to respect the dedication and the hard work of the staff that's already there. My goal as an educator is I want you to come out as a graduate and be as good of a therapist as I am right now. If you're not going to progress our profession forward and advance our profession. But I also want you to respect the things that the department and the hospital has already overcome. You may walk into a hospital and they're not doing assessment and treat teams. And you're like, wow, that's really sad. Respiratory therapists should be assessing every patient. But what you may not know is 5 years ago, they weren't even working with protocols. So in the last 5 years, they have advanced their department. So make sure you respect the hard work and the dedication of the current therapists and their seniority. Leaders also want to know how you think you can make their hospital better. How can you become a better team, or how can you be a team member and make their team better? A lot can be said about seniority. You've got some therapists who have been there for 15 to 20 years. They know some of the insides and outs and some of the ropes and the relationships that they've already built with the physicians and the nursing staff. Hey, we're not nurses, okay? We are cardiopulmonary specialists in oxygenation, ventilation, and perfusion. However, I can't do my job effectively without a nurse. So how can I move in? How can I come in and become a team member and make the hospital team better? So respect that seniority that's already out there. Be flexible. We've talked about that. Be cooperative. You're working, somebody calls in, they ask, can you help cover a shift? Be willing to stay over 4 hours and help cover a shift or be able to work with the team. Professional attire and address at the interview. This was on multiple different responses. I had a director tell me that they did not hire a, a recent grad because when they came in, they were in jeans and a t-shirt. Somebody else told me that they had somebody dressed like they were going to the club. Well, it's okay to go out after your interview, but take time to dress appropriately and professional. It might be business attire. I've gone to multiple interviews where I was in a suit and tie. I've also gone to an interview where the director told me, hey, I know you're coming straight from clinic, or we're going to interview you after your clinical shift. So we expect you to be in your clinical scrubs. Either way, make sure your scrubs are clean. If you're leaving lab, if you're leaving school and you're leaving lab and the director tells you it's okay to wear scrubs, make sure they're clean. Make sure they're not wrinkled. And that goes a long way of showing the professional respect. Cell phones, smartwatches, don't just put them on vibrate, but make sure you put them or turn them off. Tell your friends, your family, hey, I'm going to have an interview for about an hour. I'm not going to be reachable. Now, I also had a director tell me, and he said it was one of the best things that he's ever learned in the interview. He had an applicant come in and they said, Mr. Mr. Jones, and I use that name facetiously, by the way, Mr. Jones, I want you to know I have a family member that is on life support and they're expecting them to pass any minute. I want to continue my interview, but do you mind if I leave my phone on and just monitor the text messages that I get? He was he was completely blown apart. He said that's absolutely okay, and that brought that level of respect and that professionalism up both ways, by the way, because it's coming from the director and from the applicant. So if you have childcare needs and you need to monitor it, that's fine. But I've also been sitting in on an interview and no lie, every 3 minutes, somebody would look at their watch and then they would slap their hand. And they wouldn't respond. It'd go off, they would check it, and they would still be talking to us right in the middle of it, and they would slap it. Well, that applicant actually got moved to the do not hire because we thought that was a lack of disrespect for our profession and where we're at. So make sure you address it if you have that need and then follow their rule and their guides. Be prepared for the hard questions. Hey, where's your weakness? What was the hardest class you had in school? And you may tell them, hey, I struggle with chest x-rays. When I see a chest x-ray, I struggle with it. I haven't been really good. I may not have had as many opportunities in the clinical site to look at them, but follow it up with, but I want to get better. So how can I practice reading x-rays at this hospital? Discuss your class accomplishments. This is a tricky area. So your interview is a chance to sell you. because you might be competing with some other people who are also applying. But the flip side of that is if every statement that you make is, I did this, I did that, I did this, I accomplished this, some of your hospital leaders are concerned that you work by yourself and you're not going to be a team leader. So by all means, make sure you list your accomplishments, but also make sure you list and you talk about the accomplishments that you did as a team, whether it's a group project or if you were able to write a research paper as a group during your program. So, you know, I completely sell yourself, but also share how you've accomplished things as a team. Again, these are direct quotes and items from my non-scientific research project. Hey, don't be afraid to say, I don't know, but I can go find the answer. And that's where this next gen networking opportunity is. That's where some of your state societies are. So don't be afraid to say, I don't know. That's a really good question, but I will find the answer. And then make sure you follow up with it. So go home, look it up, find a resource, and then follow up with it, and then make sure and you're prompt with it. Again, one of the it wasn't exactly 100%, and we can talk about that later. But the majority of all the leaders said not just obtain your credentials as soon as possible, but obtain your advanced credentials. Get your RRT as soon as possible. And then don't stop there. You're going to make our hospital better by your obtaining more credentials. And then I actually had a director tell me, he said, but you know, just because you get a credential doesn't mean you're a better therapist. So what it does mean is it gives me as a director credibility when I go to talk to my HR people, when I go talk to about raises, when I go talk to my medical director about how can we get respiratory more involved in the decision making. He said, credentials give me a leg to stand on to argue for my department. So a lot of the hospitals around me and the people I talk to around the nation that I know, they're RRT only. They only want the RRT credential, but then they also want, well, how can I have a therapist working on my asthma unit and get better credibility? Well, I'm going to get the asthma specialist. My neonatal hospitals, they like the NPS. So don't just stop at your RRT. And then remember, be teachable. I've been in the profession for over 25 years. I teach multiple classes, but I learn something every time I go to a conference. I've actually just printed out two research articles. One was on spontaneous breathing trials because there's a lot of stuff going on. So always be teachable. Always remember you can learn more. And don't be afraid to ask questions. You're smarter as a group than you are individually. So don't be afraid to ask your other educators, your leaders, your other therapists, your other team members. Congratulations for the RRT. Use your resources. There are different resources available out there. Your school should have some resources. Your AARC has some resources, the state society. Use the internet. However, make sure it is legitimate. And then your hospital should have some resources available. So let's look at what some of those might be. Your school. I can talk about my school and then a couple of the other educators I know. We all have a career planning. The cool thing about being respiratory, we're a small family. So a lot of times your school or your department, your program director, DCE, they'll actually have some career opportunities, some planning opportunities for you. I know my school, I have an open house. And the last semester, we invite not any, but we invite a lot of the local hospitals who are who are hiring. We invite them to come in and spend an hour at lunch in between classes. So the students will all pitch in, they'll buy pizza that day, or sometimes the hospital itself will actually bring in food. So career planning, exam success. There are a lot of resources out there. Some of them are really good. Okay, I have my ideas. I have the ones that I use, but there are some out there that are not really good, um, and they're not valid. They actually have bad information about how to be successful on your exams. So make sure when you're looking for exam success, make sure you get a valid company and a valid resource. When it comes to resume writing, your school should have a resume review team or somebody who can help you. And our school actually has an interview preparation, so they'll actually set up mock interviews and then networking within your school. So the AARC, you're here today. You know this is a resource, but I'll tell you, the resources that you have through our professional society are unlimited. You get an early grad membership. It's discounted. It helps you be able to afford it because we know you've got possibly some student loans. We know you've got some credentialing exams. But here's another thing that you may not know. Your professional membership organization is or can be tax deductible. So when you pay for your membership, make sure you hang on to that receipt and then you ask your tax accountant if it is tax deductible for you and your situation. The next gen community, it's launched, but I'm telling you, it's getting ready to explode about all the things that are coming out. The AARC has some exam prep opportunities. There's a job board. There's some job postings, job information. Your state society. Your state society, every state has a board, and every state has a sister or a parent organization. I'm sorry, an organization that belongs to the AARC. Some of our small states, Rhode Island, Maryland, they actually share organizations or boards, but we also have one in Puerto Rico, so it's not just our states. So get involved. I'll brag on the state of Washington. They have a fabulous, and the state of Colorado, they have a fabulous student board. So if you're interested in how you can make a student board or a student mentorship board at your state society, send me an email. I'll connect you with the resources that I know, but I would be willing to bet, and I'd bet you a steak dinner, which is really important to me, by the way, that all of your states are interested in getting their students involved. And I know that because at the House of Delegate, every time we ask for opportunities for students to sit with their delegates, we have a 100% participation. Everybody is welcoming for students and they want you to participate. So go to your state society meeting, become involved with your state society, volunteer. Listen, we've got some states where there are 60 and 70-year-olds trying to do their social media. Hey, that doesn't work, by the way. We actually had a guy ask about, and I can't remember it now. Oh, MySpace. He said, "Are we still using MySpace?" And some of our, just the whole no, okay. So there are great opportunities for you as a student to do volunteer stuff with your state board until the next election, and then you can start running for boards. Networking, department managers, you're going to work at a hospital or a facility. You're not in it by yourself. Okay, there's no need for you to reinvent a patient assessment team if 4 other hospitals in your state have already done it. And here's the cool thing about state societies. You're not in a silo by itself. I had a hospital in Alabama reach out to me, and they are a pretty rural type hospital, and they were interested in setting up an ECMO program in their hospital. They're a non-teaching facility. And they were like, how do you do that? And I went, wait a second, I've got a great opportunity for you. So I connected them with 2 hospitals in another state who had already done that. And instead of it taking 6 months to a year to have that ECMO program up and running, it took about 3 months because the other states were willing to network and share their resources and opportunities. So the networking opportunities go beyond your state and your own hospital. I'll ask your state too about a possible student symposium. I'll share what we do in Alabama, and I know a couple of other states that do this as well. But in Alabama, in February, we have a 1-day student symposium. It's students and early grads or new grads, so early professionals. So the vendors that we have there, they're not equipment vendors, they're actually hospitals and HR people, um, and maybe some board prep companies. And it's aimed at just students. So who's hiring? How do you get a job? How do you become more professional? How do you get involved? And this last February, we actually had 30 students walk away with an interview scheduled on that day. So the resources are unlimited. You just have to reach out. Now, how about some hospital resources? These are questions that you may want to ask during your interview. And I'm trying to keep an eye on the time. These are some of the some of the questions you may want to ask on your interview. Does your hospital have tuition reimbursement for degree advancement? Hey, I worked at a facility. My master's degree cost me $400. I'm going to let that sit in. $400 because my hospital paid for it. And the reason it cost me $400 is because I wanted some extra books, there were a couple of extra resources that were not required, but they were recommended. So I just bought the books for $400. So ask about tuition reimbursement for degree advancement or for possible credential exam reimbursement. That tends to be on the lower side of the people out there that do that, at least from what I know. But the uptick of it is some hospitals are paying like $1 an hour for every advanced credential you get. So if you're new, if your exam costs you $300, all you got to do is work 300 hours. Hey, that's like 10 weeks. So you'll pay for itself in less than 3 months' time. Ask about career ladders. How do you advance? I'm an early professional. All right. So how do I get better? How do I continue to grow? So some hospitals are actually doing career ladders where if you get a BS degree, if you get an advanced credential, if you go through some specialized training, then they'll pay you more. But along with that becomes more responsibilities. You move up to a respiratory assessment team. We have a couple of hospitals in Alabama where the respiratory assessment team, they go see every patient that has any respiratory order, whether it's a medication, a procedure, or just oxygen. They assess every patient every day, and then they write the new orders for the day. And the physician comes along behind it and co-signs with it. So those are career ladder opportunities. Specialty teams. You want to work on the med team? You want to work in the emergency department? Or you want to specialize and work just a trauma intensive care unit? And leadership training. Hey, I want to be a director one day. I want to be a manager one day. How can the hospital support me in my advanced training? So one of the things I do at our school, and I've shared this in a lot of other schools that I've got a chance to meet their department or their program directors, is you should go Google and look up the AARC Guide to Professionalism. There's a document, and every department director, every school should have these printed out and taped in their lab or in their department break room. And if you read it, I got some of the highlights, but it's all about how we can elevate ourselves to a higher standard, uh, make sound decisions, function as leaders, put our patients first, and commit to the profession. And then the document gets into some more uh, specific information. So your behavior as a therapist to represent the profession as well as the hospital should reflect integrity, should support objectivity, foster trust in your coworkers, in your patients, and that's what makes you a professional. Seek educational opportunities to improve. I've seen it in my career. People will sign up for a webinar, they'll turn it on, and then they'll disappear. Or they'll go to a conference and they'll register the first day and then they will disappear. And they'll come back on the third day and they'll fill out the evaluation like they attended every um, meeting. Well, you can't learn from that. Okay, so look for opportunities to get better. Read research articles. Hey, skim the title. Hey, I'm interested in that. Look at the abstract. I want to know more. Reach out to the authors of the articles. And then maintain your scope of practice. Okay. I teach BLS also, and we laugh and we talk. I'm like, yeah, you're covered by the Good Samaritan law. And as long as you do good quality chest compressions, manual ventilation, and use an AED, you're safe. So, however, if you pull out a knife and cut a hole in somebody's throat and stick a pin in their cricothyroid membrane, so I'm not teaching you that today. So maintain or stay within your scope of practice. And respect the rights of your patients. Your patients have rights too. So make sure you read your patient's Bill of Rights and follow those. HIPAA, HIPAA, we know that it was beat into you from day one as a student. Um, Follow HIPAA. But I put some things in here to highlight. Promote care without discrimination of any basis. Race, sex, gender at birth, religious rights, height, you know, don't pick on the short people because they didn't grow as long as you did. Don't pick on the tall people because they hit their head on the ceilings, okay? Respect people, care for them, treat them just like you would want to be treated, no matter what they are. And then I like the promote disease prevention and wellness. Every time I see a patient when they come into the hospital, hey, how you doing, Miss Smith? How you doing, Mr. Jones? How's your smoking going? Well, I'm still smoking. Are you ready to quit yet? No, you asked me that last time. And you know what? I'm going to ask you that again. Because you may tell me no 10 times, but on that 11th or 12th time, you may tell me yes, and I'm going to be there to help you. Incentive spirometry. It irritates me to walk into a clinical site and do a clinic visit and hear somebody say, well, the nurses do respiratory and I do incentive spirometry in our hospital. And I tell my students that I don't care who gets paid for it, who gets reimbursed for it. Incentive spirometry is in your scope of practice. So you should always ask your patient, show me how you're doing on your incentive. Because there have been multiple times when I worked in a hospital that was under nursing care, and we would be getting ready to discharge a patient. It would still be wrapped up in the wrapper, never opened in their to go home package. So promote disease prevention, promote wellness. Ask your department, hey, how can we reach out to our community? How can we get involved in the community to promote disease prevention and wellness? And there are opportunities out there. One of my favorite ones is Kick Butts Day. Kick Butts Day is a smoking prevention program aimed at middle school and high school students. If your facility that you work at is near a school, reach out to the school. Ask them, how can we partner with you to go do some disease prevention and wellness and education for our community? Refuse to participate in illegal or unethical acts. Do not conceal illegal, unethical, fraudulent acts of others. You're not a tattletale, but you are taking care of our profession and you are taking care of our hospital and our patients. Follow sound scientific procedures. Just because um, the internet said it's okay to do that doesn't make it sound and scientific. So make sure you're following evidence-based medicine, and make sure if you are doing a research project, make sure you're following your IRB or your research board procedures to do ethical procedures and research. Again, efficacy of cost of patient care. We know patient care is expensive. All right, it is, but don't withhold care just because somebody might not be able to afford it. Help them find a different alternative. Help them find a generic medicine that they can afford. So let's look at the resume. I've actually seen resumes that directors have shared and they've kept in their files. And one of them actually had respiratory on it, or respiratory. So make sure you have correct spelling and punctuation. Check the professionalism of your contact information. If you have a funny voicemail, and I love one, okay? I love the one that says, hey, you've reached Jerry's refrigerator. The voicemail is on vacation this week. So if you'll leave me a message slowly, I'll write it down and stick it on myself with one of the magnets. It's funny, it's comical. However, if I have a department director going to call me, I may change it for 3 weeks or 4 weeks. And then check your email. I had a friend, she was actually a therapist, but she raised paint horses on the side. So she raised horses and she raised paints. Well, her husband's was in charge of the stud horse. Well, he was like paint stud at yahoo.com. That's okay in the horse world or in the horse career. But so create a professional one if you need to. J King RRT2B, future RRT. So Jerry King, and then, whatever. So make sure your contact information is professional. I'll tell you, the grammar errors and the punctuation errors from the HR people that I've talked to is a #1 red flag. So make sure and not just you, but make sure you get somebody else to proofread your resume and application. And by the way, Microsoft does not count as an editor. Google Docs that autocorrect does not count as an editor. Be prepared to answer questions. You can Google questions, what to expect at an interview. If you reach out to your local directors, ask them. Okay. We actually have a document with our state society, and it's resume questions that our state hospital or our state directors have put together. And then look at your resume. You know, you graduated high school in 2010. Well, you went to respiratory school in 2024. Well, just be prepared. Hey, I wasn't sure what I wanted to do. I worked retail, or, I got married. My husband was, or my wife was shipped overseas and in a soldier. So just be willing to answer or be able to answer those questions. And then, two, if you've had trouble, no big deal. Okay? First thing I would do is reach out to my licensing board. Be honest and upfront about any convictions, speeding tickets, DUIs. Okay, so just be upfront and honest with them. Most of them are willing to work with you. We've had some situations in Alabama where a student got a DUI. Well, it happens, okay? We make mistakes. Happening one time is okay. The student who wound up with 5 or 6 DUIs actually had some issues getting their license. So don't repeat the mistake. But the licensing board was upfront. Hey, we appreciate you reaching out. One DUI, is not going to be a problem. We may ask you to go through, to provide some information. So just be willing and upfront about it. When it comes to the interview, be there a little early. Okay, don't get there 2 hours early. Be there 10 to 15 minutes early. Be prepared to wait in the waiting room. Dress professional. Again, unless they tell you, hey, we know you're coming from a clinic site, scrubs will be okay. Again, just make sure they're appropriate. Think before you speak. It is completely okay to pause. They ask you a question. Take a deep breath, gather your thoughts, and then answer the question. You don't have to use Several directors have shared with me that they think that is a little unprofessional. So practice that. Sit down with a friend, have them ask you questions. A pause, a break in the conversation is better than you trying to fill it with A lot of times we do it without thinking about it, or we don't recognize it. So I had a director tell me they counted in a 15-minute interview, they counted 75 ums or uhs. So practice that and be aware of that. Again, make sure your electronic devices are off unless you address that beforehand. Again, share your interest in their hospital. Do a little research. Okay, how big is their hospital? How many ICU beds do they have? How many emergency room beds do they have? And if you don't know, that's where the networking opportunity comes in. When they talk to you about scheduling, be flexible. Okay, make sure you're now. If you're getting married, be upfront about it. Hey, I'm getting married in 3 months. I have my honeymoon already scheduled. They may tell you, okay, you won't get paid for that week because we have a policy that you can't use vacation time for the first 6 months. Okay, I'm fine with that. I'm good with that. But don't walk in I had a director tell me he had a student walk in and say, hey, can I have spring break off? And they were like, no, you don't get spring break anymore. Because they not only wanted spring break off, but they wanted Memorial Day off. They wanted 4th of July off because their family was going to the river. So You have to have flexibility in your scheduling, willingness to work with them. And then you should use your vacation time. Okay. It's there for a purpose. And then Lori's right. Have a couple of questions in your mind that you want to know. Ask about the opportunity to advance your credentials or maybe reimbursement. Ask about, hey, what are the goals of the profession? Is the profession moving forward? Do they do protocols? Do we have career ladder opportunities? You know, um, show them that you're not just passionate about working and getting paid, but you're passionate about the care and the profession. Oh, I will caution you this. Don't tell the directors I told you this, okay? We've had several directors say, hey, I have a student that walks in and the first thing they do is, hey, I only want to work here for 6 months and then I'm going to travel. Well, you don't understand the time, the money, and the investment that hospitals and directors have in you in the interview and the hiring process and the orientation process. It takes over 2 years for them to recoup that. So if they know that your goal is to travel and you only want to come in and get some experience from their hospital, they're probably not willing to invest in you if they know you're getting ready to leave. If Lori said more than 2 years in the rural areas, absolutely. If you're pregnant, hey, don't be afraid to talk about that. Hey, I'm pregnant, or my wife is pregnant. When she delivers, or when I do it, I'm going to need some time off, but I want to, I will come back. Or so uh, there's some laws that protect you in that hiring process, but be in your professionalism, make sure that you're looking at the respiratory care as a profession. If you want to go back to PA school, or better yet, if you want to go back to APRTE school, yeah, that's the ticket now. That's completely fine. Okay. We want to support that. I've got former students who went to medical school. I love it because when they come back to practice, they already know what my profession can do. And they actually, to me, make better medical directors because they're going to challenge the staff to do things. I've had former students who went to PT school. You know where they function best? In the ICU. Why? Because they're looking at not just the physical therapy or the rehab, but they're looking at the ventilation and that side of it too. So having multiple credentials and moving forward is completely okay. But my main goal as an educator is to train respiratory therapists. The main goal for our hospital directors is to hire respiratory therapists for their hospital and make their team better. So it's okay to go back to school. I will 100% support it, but don't let them know that that is your priority within the first year or 2 years of working. So during your process, discuss your successes and your struggles. We've talked about it a little bit. You can use I, but make sure you include we. And that we shows you or shows your director that you are a team player. Maybe an opportunity where you're the team lead and you're able to lead the team. Maybe the opportunity where you just a team member and you were able to function and just, take assignments, personal achievements, some of the things that you were maybe able to do outside of school. How are you able to service your profession? Did you do community service in school? Did you step out of the school requirements and do extra things uh, that were not required of you, but things that you wanted to do? And then talk about your struggles. Okay, they're not weaknesses. They're things that you're not as strong in. Okay, Everybody has some. You know, a lot of times coming out of school, it may be PFTs. It might be hemodynamics. It might be chest or radiographic assessments. So be willing to say, hey, I'm not great at this, but I want to learn more. And here are some of the resources I have for that, or I'm looking for other resources. So talk about those too. And then after the interview, make sure you say thank you. Uh, most of the directors tell me that one of the best things that they do is get a thank you note or get a thank you email. If you handwrite it, guys, make sure it's legible. You know, medical jokes. If you handwrite the note, make sure it's legible, and it's just a quick brief, 3 to 5 sentences. Hey, thank you for your time. I enjoyed the tour of the hospital. I enjoyed getting to meet your staff. I look forward to working with you in the future. If you don't get the job, it doesn't mean you're not going to work with them. If you don't accept that job, it doesn't mean you're not going to work with them, because you may network with them later on, or you may work with them on a research project. So make sure you follow up with them. All right, the new hire, you come in ambitious, ready to conquer the world. Everybody's going to intubate. We're going to put in art lines. We're going to take over everything. You know, take a deep breath. All right. We are excited. We're ready for you to work, but make sure you go through a good orientation process. And that's a good question to ask during the interview. What is your orientation process? We've come a long way in 25 years. My orientation was, here's your assignment. Here are your meds. Call me if you need anything. My orientation was 2 days. The first day, I was with a fellow therapist. The second day, I was with another preceptor. That preceptor's child got sick. That preceptor had to go home. The supervisor went, hey, you were a student here for 10 weeks. You know where everything's at. You can handle it. Call me if you need anything. Now, the good news is that orientation process has gotten a lot better in the last 25 years. So listen, okay? I'll be honest with you. In the 5 semesters I have respiratory students, I cannot teach them everything I want them to know. If I was building the perfect respiratory program, it would be about 3 to 4 years, about 3.5 years, in order for me to teach you everything I wanted you to know. We can't do that. We don't do that anymore. We've got it down to 5 semesters, some 6, some 4. So your orientation process is another way to learn not just what to do, but how they want it done in that hospital. So again, right out of the gate, get your credentials. The number one comment from directors, get your credentials. So here are some direct quotes, and I did not. I mean, I copied and pasted this. As for new hires, I want them motivated, ethical team players. I do not, and they had it underlined in bold. So I did tweak it a little bit. My PowerPoint tweaked it a little bit. I will not or do not hire anyone who is late or unprepared for clinicals. So if you're a current student, let that sink in. Be there early. Get there for shift report. Make sure you have your stethoscope. I do not hire anyone who wasn't motivated to get their RRT quickly. And then I do not hire anybody who will tell me what their work days will be. Work ethic is a big issue for this director. Students come in with great expectations of their schedules and assignments, but make sure you're willing to be a team. Confidentiality, HIPAA, again, that is really big. And then look at the bottom sentence or the middle sentence. They need a positive attitude, constructive criticism. Don't become defensive. Be willing to learn and don't be tardy, be on time. Again, when you see this, you can look through it. It's really all the same. It's about personalities, working with others. In your interview, make sure you have questions for them. How how does your department support the AARC? Future goals and beyond. So I'm speeding through it because we're running out of time. What's the department doing for research? Can you be a disease or a case manager? All right, the end. Actually, not really. It's really not the end. It's really just the beginning. And here's you, dear future. I'm ready. Questions, fears, thoughts, or grumblings.
Hi, Jerry. This was so fantastic. I definitely saw engagement. Of course, I was chiming in on little things, but I definitely saw engagement in the chat. We do have a few questions. And so the first one actually comes from Raed. And I apologize if I absolutely mispronounced your name. But he asks, or they ask, sorry, from your experience, is hiring international students a common concept? They're asking because they attended Congress and most hiring managers were not familiar with the concept or simply didn't seem interested. So, what do you think?
There's a process that hospitals have to go through. I'm not really familiar with it. It's about green cards and visas and how long you can be here. Some hospitals are upfront about it and they'll tell you, no, we won't do it. Some hospitals are, yes, we will actually support everybody and they'll sponsor you as an employee. So that would be a great question to ask, to the HR people when you see uh, the application process. There's usually a contact information, and that would be one of the first questions I would ask them.
Perfect. Thank you. Also, this is a question that kind of was inspired from a comment in the chat. So one of our individuals or attendees mentioned that their experience with clinicals is they go and they kind of do the tasks of the therapist, but they're not really being taught by the therapist. So my question to you is, how should a student make the most of that situation or find a way to improve that situation?
A couple of things. Great question, by the way, and great comment. And by the way, that happens nationwide. So my first comment is if you're a new hire in about 2 years, there's a potential that you will be a clinical preceptor. So when you are become that preceptor, remember that. As a current student, ask questions. Okay, you're going to have some preceptors and they're not motivated. They don't want to be there. They don't want a student. You may have to just really get through that day. Share that information with your DCE. DCEs are there to protect you, but they're also there to help the preceptors get better. But ask questions. Ask your preceptor, hey, I know we're getting through. I'm studying ABGs. Can we go look at a couple of ABGs? Or I haven't had a chance to see an art line draw. Can we find a possible art line today? So don't be overbearing. Don't ask 100 questions every day, but kind of bridge that gap. My favorite story, and this I'll make it quick. A friend of mine went to clinics one day, and they had a jar on the table, and it said respiratory assignments. Whoever drew the short stick got the student that day.
Oh,
So luckily we fixed that problem. But the the therapist that got her they said don't go with her. She's the grumpiest, she's the meanest, and she hates students. Well, my friend didn't have an opportunity to change. So she wound up with it and she was like, I'm going to kill her with kindness. She was polite. Said, yes, ma'am, no, ma'am. She asked questions. Hey, I don't understand why you did that. Can you help me learn? She didn't say, show me what to do. She said, help me learn. And by the end of the day, that preceptor and my friend not only became, coworkers, but they became friends. The next time they showed up, that preceptor volunteered to take my friend, and she wanted her, and she actually had a great clinical experience. So ask questions and ask for, can you show me some opportunities to learn? Or I like the way you did that. Do you care if I duplicate that and copy that as I progress in my career? So there are ways to bridge that gap.
Perfect. Thank you. Just a few more quick questions. How important was mentoring to you throughout your career? And if you had any mentors who maybe helped you along the way as you grew in your career?
About 5 or 6 times a year, I will send texts and emails to people today that influenced me as I was a student. They were my preceptors. I've had some coworkers, directors, and supervisors. And about 5 or 6 times a year, I will reach out and go, "Hey, I just want you to remember, I appreciate everything that you did. You helped make me who I am today." And
Perfect.
I still have mentors today. I've got other educators. So it doesn't stop. Even when you become a mentor, you will still have mentors with you. So take a second and make sure you tell them thank you.
I love that. Thank you so much, Jerry. Also, another question: how can I communicate in an interview or cover letter that I'm a good bet as a clinician if I haven't had any work experience yet?
Share your clinical opportunities. Opportunities that you learned. We talk as educators. We talk how you've got a student. They look at you. They look at you, and then all of a sudden they go, and that light bulb comes on. So share opportunities where you were in lab and you did not understand something, and a fellow classmate explained it, or a teacher explained it, or an opportunity where you actually were explaining it to another student. So everybody has experience. Some people are more experienced than others, but everybody has opportunity or has experience where they have learned and gotten better, and just focus on those.